Hi everyone, my name's Jasmine, and today I'm going to be exploring the effectiveness of mindfulness meditation in managing anxiety disorders. So, we'll dive into some recent studies that I found that I'm super excited to share that look at these practices and compare them to different medications. And so, we'll uncover why mindfulness is becoming such a promising approach to mental health care. I am super pumped. Every year, over 40 million adults in the US face anxiety disorders. A lot of the common treatments are therapy and medications, but many people face different challenges and barriers like cost and different side effects and just also personal preference. So that's why having alternative approaches like mindfulness meditation is gaining so much attention. So the Mindfulness Based Stress Reduction Program, also called the MBSR, is an 8-week course that combines meditation, mindful movement, and body scanning that's designed to help people manage stress and anxiety. So today we'll be exploring 4 recent studies to see how these different things are effective for anxiety and exploring the strengths, limitations, and gaps in this research. Mindfulness isn't new. It's been practiced for centuries. It is an ancient, deeply sacred practice that began in Eastern traditions, especially in Buddhism, as a way to cultivate emotional balance and reduce stress. In the West, it was formally introduced in the 1970s by John Kabat-Zinn through the Mindfulness-Based Stress Reduction Program. Since then, researchers have explored its potential for treating anxiety, sparking debates about whether it can be a standalone treatment or works best alongside traditional methods of healing. Hoag's 2023 study was a randomized clinical trial, the gold standard for testing treatments. Adults with anxiety were randomly assigned to MBSR or escitalopram, which is a common antidepressant, for 8 weeks. Anxiety was measured using the Hamilton Anxiety Rating Scale, and both groups had significant reduction in anxiety, but the MBSR group reported fewer side effects, such as nausea or fatigue. This shows that mindfulness can be just as effective as medication while also being gentler on our body, and it equips participants with lifelong coping skills. Zanel's 2024 study focused on people with generalized anxiety disorder using a short, self-guided mindfulness program. So participants participated for 10 to 15 minutes daily at home. They measured anxiety using the GAD-7 scale and tracked stress and attention. Results were impressive. Anxiety scores dropped significantly, and participants reported better focus and coping. This highlights that even brief mindfulness practices can make a meaningful difference, not just the structured MBSR courses. WHO's 2024 study compared mindfulness meditation to escitalopram in over 200 adults with anxiety, using standardized tools like the Beck Anxiety Inventory. They tracked symptoms over 12 weeks, so both approaches reduced anxiety, but mindfulness participants also showed better emotional regulation and developed skills to prevent relapse. This study emphasizes that treatment isn't just about quick relief, it's about giving people tools that they can use for long term. Calderon's 2024 review looked at the neurobiological effects of mindfulness using brain imaging studies. They found that mindfulness practice actually strengthens our prefrontal cortex, that spot in our brain that regulates emotions, and the insula, which enhances body awareness. These changes explain why mindfulness can improve attention, emotional control, and stress response. It shows that mindfulness isn't just a wellness trend, it actually causes measurable changes in the brain that support mental health. To sum it up, the research clearly shows mindfulness meditation, especially MBSR, is an effective tool for managing anxiety. It can work as well as medication while offering extra benefits like fewer side effects, improved emotional regulation, and skills that people can carry with them for their entire lives. Studies also show that mindfulness is flexible, whether through structured programs or short self-guided exercise. With millions affected by anxiety, integrating mindfulness into mainstream healthcare could provide more accessible and holistic options for mental health support. These are my references if you want to check them out. Thank you so much for watching.